Okay, well, there's our cue to get started. Welcome to the Institute's Autism Echo. Again, if you'll put your name and contact information into the chat, it's just a way to continue to build our networking with each other over this virtual world. We are recording today's session. We use this for educational and quality improvement. By participating in today's session, you're consenting to be recorded. So don't hit that leave button, but if you have big objections, please disconnect from the session. Again, just a huge shout out to the children with special health care needs at Department of Health and Human Services who help provide funding for this project. We're really grateful for that partnership so that we can do this ongoing ECHO training. If you've never joined an ECHO session, welcome and thank you for joining today. We have three components of that. We have subject matter experts. Today we are joined by Jason Fox, Lisa Smith, and Dr. Koncinsky. I already told her I was going to hash her name, so I apologize in advance for that. And then we do have case presentations and a small breakout group discussion where we continue to build that professional networking. So hopefully you'll stay on enjoying that one. We love interactions, so put your comments and questions into chat. Colin, one of our hub members, will monitor that chat for us and make sure your questions are getting answered. We love case narratives. So if you have a case that you would like to hear from all of these amazing people on the call, please reach out to us and we will get you on that list. There's amazing resources and knowledge on this call, and so it's a great way to learn from each other. You can email autismecho@usu.edu and we will get you on the schedule. We love, like I just said, interactions. So if you would feel comfortable, if you want to turn on your camera, it really helps connect us to each other. It's always easier as a presenter to see faces on the screen versus some black screens. So those cameras really help us. And it, again, just builds that professional networking and our community that we hopefully are getting through these echoes. Please respect the presenter using your chat or raising your hand. Love if you introduce yourself so we all know where we're from and we can tailor our answers to your questions. So, and then just make sure you keep your questions brief and on topic. We do talk about sensitive topics, so please remember to protect individual privacy, de-identify any information. If you have any questions about that, you can reach out to one of our hub members. They all have an asterisk or will now have an asterisk in front of their name so that they are easier to find on chat. We've all been on Zoom forever. I think that we probably all know how to change our profile and raise our hand. But if you have any questions or aren't able to do that, you can reach out to myself or Leo and we will help you find those on your Zoom. In order to get a credit of attendance, we do ask that you complete a survey. And thank you to everybody who always completes those surveys. It again lets us share that information about the work that we are doing with these ECHO projects. The surveys are sent out throughout today's session. Tori drops them in chat as well as at the end with our post email. And our certificates are emailed monthly for you to use. We do have Canvas, which is where we store everything. So PowerPoints, resources, all the recommendations from case presentations are stored on our Canvas page. If you want access to that, please again email autismecho@usu.edu and we will get you set up on our Canvas page. just another plug for case studies. They are a great way to hear from everybody on this call, and great resources and information is shared. We also have social media where we share things about our sessions, resources that are shared with us, and anything about our upcoming sessions. So I'm going to stop sharing and turn it over to our amazing subject matter experts for today.
Awesome. Thanks, Janelle. And then if you could remind me for our presentation portion for today, the time frame that we are shooting for.
You have up till about 12:50, 1 o'clock.
Oh, okay. So almost the whole hour then.
Yeah.
Okay, perfect. We will go ahead and get started then. I believe I'm sharing my slides. I'm
Yes, you
getting
are.
heads shaking that that's correct. Fabulous. Well, good afternoon, and thanks for joining us today. My name is Jason Fox. I'm the administrator at the University of Utah in the Department of Pediatrics for both our developmental assessment clinics and then also our general pediatric clinics. And today we're going to highlight some of the work that we have been doing in both our developmental assessment clinics and our Gen Peds clinics related to improving engagement around early childhood development and engagement with Hispanic and Latinx families. I'm going to start us off looking at some literature, data, and programs we offer in our clinical settings. And then Lisa Smith will take the next portion, providing some more context on how this has been developed in our primary care setting. Then lastly, Dr. Koncinsky will be focusing on early childhood development in the clinical setting. One of the things we will be highlighting today is the theme that a multi-pronged effort establishing multiple touch points of interactions with families of this patient population is one of the key strategies that we have and continue to use. This allows us to better meet families where they are at, understanding from both the data and from our own experience that these families have so many variables they are trying to navigate. I'm going to focus on some of the literature and data, and again, some of the programs and strategies we're using in our clinic. So next, if we go ahead and take a look at some of the data on culturally and linguistically minoritized populations, of which actually Hispanic and Latinx comprise the largest group. For the work that we do in both our developmental assessment clinics and our Gen Peds clinics, I want to call out that final point of addressing the avoidance of utilization of services. This is one of the areas that we both find challenging, and we also try to employ strategies to address this to be successful in having our kiddos seen at appropriate age intervals in early childhood development, both in primary care and then when needed in our developmental assessment clinics when they are referred on from primary care. If we want to look, oops, I don't think I advanced my slide. There we go. So if we want to look at some national data, here is a table from the Centers for Medicare and Medicaid Services. This is on average wait in days from referral to the first visit for an ASD evaluation. Highlight first visit because this is often a multidisciplinary approach where patient and family are going to see multiple providers. You can see from the first two boxes that there is a 10% difference between white versus the Black, Indigenous, and people of color populations. And those, again, are average weight, so the number is days. And then you can see there's a 1 month difference overall for English compared to preferred language other than English. Okay, and now we're going to dig a little bit more into the programs that we have. So starting with our university developmental assessment clinics, I'd like to call out that the work we are doing in our child development program and within that program or our Aspire efforts, and you can read the acronym there. From our data, we know that we are working with a large proportion of families that live in either medical underserved areas and or also non-English speaking families. As pointed out in the literature and also our experience, it's that these children are less likely to receive timely evaluation, which ultimately delays access to getting the services that they need. Within our Aspire program that was formed in 2021, we actively work on addressing these. Our overarching goals are to improve systems of care and promote equitable healthcare access. And then in those bulleted points, you have a few of the programs that we have built and are continuing to work on to improve access for this patient population. I just wanted to kind of give a shout out for all of our partners in this Aspire work. And to be honest, I feel like probably 80+% of the people on this call today are probably either represented on this slide or should be. So if you are not, I apologize. But together, all of us, and I think everybody on this call, our goal is to provide families caregivers, adolescents, and young adults informed care in our community. Our strategies are built around helping and working with our families, with our educators, and with our clinicians in our communities. Again, just want to thank everyone on the call today. Hoping your organization is on this slide. If it's not, you can always put your information in the chat or email me separately after, and I'll get that updated. Another look at some data. So we wanted to look at, oops, I guess I actually have to advance that. Oh, sorry, it is this slide. So this is just showing that approximately 30% of our families within CDP identify as Hispanic, and 12% of our families require interpreter services. Based on that, we're always continuing to work on developing and improving our program in terms of how to um, uh, build services for Spanish-speaking families, both within Aspire and then with everything that we do. Again, with that overarching goal to ensure equitable access to non-English speaking communities in Utah. And when I say Utah, I should actually say regionally. Really, we're seeing patients from Utah, Idaho, Wyoming, Nevada, Colorado. And if not everyone's familiar, actually, the University of Utah, as an academic medical center, serves the largest catchment area in terms of miles for any other academic medical setting in the country. So looking a little bit more at our population within our child development program, this is a more descriptive drill down of what we're serving. You can see that we have high proportions of families that come from medically underserved areas, primarily speak a language other than English, and we serve families that speak 37 different languages. And I feel this slide is about 12 months outdated, so my guess is that 37 is probably a little bit higher now. Okay, so our rapid autism diagnostic or our RAD clinic. This clinic was specifically created to address wait time to be seen for an autism evaluation. It allows for providing a more immediate and shorter assessment for young kids that have many of the common autism characteristics that we see. So to qualify for this clinic, a child must be under 36 months old, minimally verbal, and the referral must have the primary care listed as autism. Since the start, we've held RAD in an underserved area in the University of Utah community clinics to increase access to families being seen there. And that, no surprise, would be our South Main clinic. Having now used our RAD model for multiple years, our goal is increasing the frequency of our RAD clinics to serve as many families as possible. And I think basically in a 24-month span, I believe we will have increased sort of our access to this RAD diagnostic model by 200%. And we're taking our next step up on that, hopefully June 1st. And again, this is really focused, not this clinic, one of the primary focuses or reason behind it is seeing in underserved areas, populations in our communities. I wanted to go ahead and just give a quick shout out for Spark if people aren't familiar with it. So Spark is University of Utah, that is partnered with Simon's Foundation Autism Research Initiative to create the largest online autism study. The goal of Spark is to speed up research and advance our understanding of autism to help improve lives. Individuals with autism, biological parents, and siblings are all encouraged to participate. You don't have to leave your house to participate. You can mail in a saliva kit along with your survey. And then once the survey and sample is collected, you return it in the mail. And then once both of those have been received, you are sent out an Amazon gift card for $50. So there's more information there on the slide for Spark. So now we're going to shift over. So that first part was focused on the developmental clinic and again, child development program and our Aspire and RAD model. Now we're going to look at primary care. This is some information about a survey we administered back in 2022 to both better understand barriers and then educate those at our South Main clinic, as well as educating families with children in our target population. And for those that don't know, South Main is a clinic that serves a largely underserved population, roughly 80% Medicaid. I believe over 50 or 60% Spanish speaking, Lisa, is that correct?
Yeah,
Um,
right.
and, and that in, that increases when you refer to parents versus kiddos. Um, So, in terms of the survey that we provided, we were recruiting families from, again, our population at South Main. To meet the criteria for the survey, it was any kiddo between the age of 0 and 6 who hadn't received any primary care services in the past 24 months, contacted using several methods. And we utilized a digital survey administered to parents and guardians of the kiddos. And then when we look at the survey results, um, one second. Oh, yeah. So when we're looking at these results, you can see that texting is the preferred format in terms of what we got back. And again, highlighting we were focused on both the younger patient population and those not attending their regularly scheduled well child care visits, where we're hoping we can provide age-appropriate developmental screeners and tests. So the larger survey went out to anybody who hadn't been seen in 24 months, but again, for the purposes of what we're focusing on today, we were looking at the little kiddos. So in terms of looking at some of our results, um, just one second. My slides got a little mixed up with the notes, so give me just one quick second. So here's a look at the results of the survey. As both seen in the literature and our patient population, identifying concerns for development or infrequently identifying concerns for development, which is something typically not identified by this patient population. So again, you can see of the 37 or 39 results that we got back, only two of kiddos in that age group identified a concern about development. We also had a lot of patients identifying that they didn't need at least an annual appointment for their kiddos for a well child, which again, for this patient population, is a perception that isn't true. When we miss these visits at these identified intervals, families miss out on their children being assessed for certain developmental characteristics that would identify, can lead to further assessment and treatment, that lead to overall improved outcomes for children. And I definitely want to highlight also referral out to services of many of what your organizations do. If we can't see the families, we can't get them that information. And so you'll see here by the colored bars, or sorry, the colored graph table, blue being the overwhelming largest barrier identified to accessing service, which is not being able to get the time off of work to go to an appointment. So that's clearly the biggest piece of the pie. One strategy is offering services during non-traditional clinical hours. So at our South Main Clinic, we don't currently have the ability to offer services outside of that standard 8 to 5 time range. But we can refer families over to our Sugar House Clinic. And Sugar House actually starts seeing patients at 7 in the morning and then is able to see patients until 7 o'clock at night. And it's also conveniently located on lines of public transportation like South Main Clinic. Over time, we've gotten better at utilizing tools like calls, text reminders to include the frequency and ease of reminder of appointments. Um, Another thing we would point out is that on this translation piece, so the green piece of the pie, South Main is a clinic where translation services are available, and over 95% of our staff are bilingual to assist with translation where needed. And in addition, for our frontline, we also utilize telephonic, video, and in-person interpretation. And again, going back to that blue piece of the pie, we do have a clinic within our Gen Peds group of clinics that can serve patients with earlier and later hours. So then in terms of where patients learn about community resources, here are the results from our survey for both our English and our Spanish-speaking families that responded. Responses show that schools and then the Women's Infants and Children, or the WIC program, of which we actually have those WIC services available at South Bend Clinic based on the fact that the clinic is housed in a Salt Lake County Health Department building, which really helps in terms of being able to provide those wraparound services for a patient population that can really benefit from it. And then lastly, the other two high areas were doctor's office and from friends and families, are the other high touch points. So I believe that is my portion. I don't know, Lisa, if you wanted to take over and drive or just tell me when to advance, I'm fine with either.
I'll tell you when because I have no idea how to take control.
Sold.
All right.
Oh, sorry, Lisa. One thing we were going to do is we were going to stop at each section and see if people had questions up to
Great.
now.
I think that's a great idea.
I think Colin was going to let us know.
Yeah, and it looks like we're good to proceed.
All right. So as Jason mentioned, I'm Lisa. I am the nurse manager at our South Main Clinic, which houses a very large underserved population. Majority of our patients are Spanish speaking, or at the very least non-English speaking. And so we've done some projects to try and identify ways that we can better help families and support them in managing access to resources or screenings. So this section, I'll kind of talk a little bit more about how we approach those early childhood developmental screenings, how we engage the families, especially our Hispanic or Latinx families, and how we're connecting those children to resources when there are concerns for developmental challenges. So when we talk about interventions, not just meaning like therapy or specialists, some interventions would just start right there in the doctor's office, screening, education, simple tools that we try to implement and use on a regular basis. All right, Jason, next one. So at our clinic, which probably is similar to a lot of other primary care clinics, we've built developmental screening into the normal workflow for all of our visits. And making it just a standard, we do this with everybody, hopefully helps ensure that we're not missing children that could benefit from this early screening or early resource access. And again, it's more than just one person's job. It takes the whole team from, the people that are scheduling the appointments, the MAs that are rooming the children, the providers that are seeing patients, and nurses and care coordinators that are following up afterwards. All right. So what we did a while back is a project to really fine tune what our screening procedure is and what we're doing, like who does what and why. So the front desk, if we're able to give the families the screening tool when they check in, so they can have something that they can be doing in the waiting room, filling out a screener. Not a lot of our families choose to do that. But we give them an option. When the medical assistants are rooming the patients for their well child checks, we are using the SWIC and the POSI screeners at regular intervals, and that team is going through the questionnaires with the families if they need to, or we're utilizing a Spanish paper form for those that prefer to read in Spanish, or using an interpreter to go through and read the questions for other non-English speaking families out there. And sometimes having to explain what do I mean when I ask that question. I think a lot of people have encountered where, mom of this child perceives the question to be asking one thing, where dad of another family thinks it means something different. So really, in our team sense, understanding it is a screener. It is not a end all be all tool, but that it hopefully will spark conversation during the visit with the provider. So providers then can take the results and review that with the family. Again, sometimes I think providers have found, flags are like, oh, hey, I see, your answer here is this, tell me a little bit more about what that means for you. And finding that, either the family may be describing something that is actually very normal development, or what they think is very normal development. We're like, actually, it would be great if the child could be meeting this milestone sooner or in a different way. So again, these screeners can be more of a conversation starter than, they scored a 5, we're good, moving on. But really, and educating the providers too, as they run through our clinic as residents, what to do with these screeners and how to have that conversation. And based on that conversation, then offering guidance and resources to the family while they're there in clinic. At 24 months, we provide the little, prescription for play Lego kits to promote play as a part of the developmental milestones for young children, and how play actually plays a big role in kiddos' development. And, play isn't just, like, oh, here, play with these while I make dinner, but, what you do with your child in a sense of play is actually very important to their development. Our care coordinators, should we have a child that has concerns for a developmental delay of some sort, or a concern just we would like more information, so we would like to access community resources, we have set up a flow where the providers can easily go, oh, this is how I'm going to refer, and our care coordinator team will then take those referrals, ensure that the referral gets sent to the right place, and that the family is followed up on kind of, hey, we referred you to, early intervention. Were you able to contact them? And why not? Oh, can I help you? Let's conference call and do that together. And I think part of what's been useful at our clinic that we've really benefited from our staff being bilingual Spanish speaking for the most part is that we have staff that can just sit down and talk to them, without a language barrier. And that has been helpful to break down as many of those language barriers as we can. And I think just that connection of, hey, someone like me is, talking to me and understanding, and can be that bridge to the rest of the team, where, I don't speak Spanish, but, having somebody on the team that does can really bridge that gap. And I think helps, kind of encourage the families that do not speak English to connect and go, okay, it is worth calling early intervention and getting my kid connected to resources to follow up on that. And so, like I was saying, the referral, we have a specific referral, and we've tried to lay this out for our providers to make it really, really easy so they don't have to go, I don't know, where's the referral? What information do we need? But it's just really clearly laid out. So, okay, provider, this is the order you need to put in, and this information comes in. We have smart phrases in our medical record. And we've worked with some of the early intervention organizations and said, hey, what information do you need from us that we can easily provide? And so we've put this together to make it really, really easy for that information to get transmitted to the community resource that we're sending it to. This also, makes sure that it's, this doctor put in, half of the information, somebody else put in different information. So we're really streamlining, making sure it's consistent, that the information between our clinic and the community resource is consistent. And this also allows us to track the resources and go back to how many people did we refer to early intervention? How many of them are getting connected to that resource? And maybe if they're not, why is that not happening? All right. And then we also, before the patient even leaves the clinic, they are going to get information from Bright Futures on, what to expect developmentally and, between this visit and their next well-child check. If we are referring to an early intervention or other resource to help with, whatever delays we may have encountered, we are making sure the families know what resources are being sent, so that it's not a surprise if they get a call. They're not like, wait, what? I didn't know we were referring. But that in their after visit summary, they have, like, your child is being referred to early intervention because here's the reason. And then also really encouraging families like, hey, you can take that step. You don't have to wait for early intervention to call you. You can call this number and be proactive to do that. If you run into challenges, please contact the clinic. We will be more than happy to help facilitate that phone call or that connection with the resource. And hopefully that, reduces the fear of trying to reach out, increases their confidence. And really, we want to empower parents to advocate for their own child and, giving them those routes on how to do that. And we've definitely had care coordinators that have done conference calls where they're like, let's do this together. Instead of just doing it for them, but really walking them through and being like, I'm here. I will do as much of the talking as you want, but you can hear the conversation. And so it's not a mystery about what's going on and where, what happens on the referral side of things. Okay. And in our clinic, we have tried to, make the developmental assessment, like, watching milestones is an important normal thing that we do. And so we put up these posters that we, have gotten from the CDC. They have the little QR code where they can download, the app to help personally track their own child's milestone achievement. And also just giving them, oh, hey, oh, my child's 9 months old. This is where they should be. That can also, again, open a conversation where they can go, hey, wait, my child is actually here, but they're, yeah, this age, I want to talk to the provider a little bit more about that. And what does that mean? It doesn't mean that, my child's really behind, or does it just mean that they're, on this slower end of the normal range? But having those bilingual resources in the room for families to be reading, again, hopefully is normalizing. Like, we ask these questions of everybody. Everybody's got, concerns about development, and every child kind of develops at a different speed, but there's still, kind of a guide of where we would expect them to be. And just really hoping to encourage families to ask questions if they are noticing differences in their own child. And then that's just a little bit bigger poster. We have big posters in the hallways too, so that that families can access the resources. And then Reach Out and Read is a program that our clinic participates in an effort to promote literacy in young childhood. And the CDC actually has these printable PDFs. I don't know if they have the actual books you can order anymore, but these have been really fun books because the books themselves have the milestones in them. So as the parent is reading to the child, and they come in English and Spanish, they might have other languages as well. They can really just, go, as the parent's reading, they can go, oh, look at that milestone. And, that's another tickler, a reminder for the parent. On the next slide here, you can see that example of what the page looks like. And, I think just a helpful tickler, where parents maybe aren't, have a bookshelf full of, child development resources in their kitchens that they're looking at every dinner. But hey, if they're reading a bedtime story, they can have a little tickler of, what things might we be looking at as this child grows up. So, and outcomes, kind of as we have developed this workflow in our clinic, we have become more efficient and more consistent in identifying those children that are at risk and need referrals and connections to community resources. We're doing better at following through on that, and actually have noticed even better communication back from the community resources when we send it. It has helped for us to get that information back where, for example, early intervention, send us a message back saying, hey, you referred Susie Q for early intervention services. Here's what happened with that referral, whether it's we were never able to reach the family. And then we can hopefully jump in and go, okay, we can contact the family because maybe the family's like, I don't know that number. I'm not going to answer the phone, right? We've all been there. And if we can call from clinic and say, hey, saw that you had some challenges getting connected with early intervention. How can I help connect? Or answer questions where parents are like, oh, I'm not concerned anymore. I don't think that's an issue. We can, follow up with the family by phone. We can make a note to follow up at their next appointment to get a little bit better idea of, maybe are the parents paying more attention to those developmental milestones and going, oh, actually, they are doing that. I just wasn't looking for it. Or is there still a concern and do we need to have another talk with family and explain this is why we're concerned and why we would like you to connect with another organization to really support your child. And then next steps we're hoping we are going to be partnering with Healthy Steps and hiring a Healthy Steps specialist to implement the program and utilizing these core components in early childhood, 0 to 3 years, really focusing specifically on that development, having the specialist go in with the provider for these well-check visits and be a touch point for screenings, resource connection, or even in clinic brief therapy or intervention while they're there in clinic. Really excited to see how this happens. We're, so if you know anybody who, a social worker that's maybe looking at, early childhood work, hopefully we'll be posting a job soon. Um, and maybe, in the future we can report back and let you know um, how this does increase screening and connection with resources. And that's all that I have. What questions from my section can I help answer?
Yeah, so, we have a question from Janelle, and it's thinking back to your referral process. Do you typically get information back from the agency you referred to?
Yeah, that has gotten a lot better. And I think part of that is what that smart phrase that we use, the text that we have the providers put into the referral, um, along with the cover sheet we send with. In that cover sheet, we are saying, this is who we are. This is, it's coming from South Main Clinic. Please, either fax or, call with an update on the status of the referral. And not every time, every referral do we get information back, but definitely way more than we used to.
And that was the only question we had.
Okay.
Great. I guess it's my turn. And
before you
you're
start,
okay,
I'm going to jump in. This is Janelle. Sorry. So the CDC Learn the Signs Act early materials that Lisa was referring to, I have dropped in the link for CDC's page. I am the Act Early ambassador for the state of Utah, and so you can order materials directly from myself by emailing me, or I also put in an order link if you want any of those free materials.
great. So, Jason, hopefully you're okay with staying in charge of the slides.
Absolutely.
Okay, perfect. So I'm just going to talk a little bit about kind of developmental milestones and how to kind of think about them in context of different cultures or different, languages. And, our focus is on the Hispanic, Latinx community, but really, this is something we can think about with any other population that is non-English speaking, as we've seen that those tend to be later for referrals or harder to, come into clinic and make sure they're getting their appropriate screening. And so why does it really matter? Most of the time, the milestones are based on population data, which means that, it's not going to represent every child, especially if there are cultural or linguistic differences. And so those really are a guide for both parents and the providers, and really kind of understanding how the child's culture and family has shaped their development. So is there more of the family component? Is there more, like sibling components? Those sorts of things are very important to understand, and especially what languages are talked about at home. So I think, not only that, but then once we understand what their expectations are, then we can determine what would be the best next steps for intervention, or how to help them, as Lisa has kind of talked about, in terms of, maybe working on a care coordinator to get them connected, because it may be, a barrier to care. So next slide. And so there are lots of different domains of development. And so we have our social emotional, which is our relationships, and our language and communication. And again, in this population, we're going to be thinking about the bilingual development, cognitive development, motor development, and then adaptive and, self-help or self-care. And, every family is a little different in that area in terms of what they expect children to do at different ages in terms of chores or doing things for themselves. And so kind of understanding the expectations of the family for that child is important. Kind of asking, like, what our expectations are, does that align with their family values, is very important also. So next slide. then again, development is relational and contextual. So we build it over those relationships, and in Hispanic and Latinx families, they often have that collective caregiving, sibling involvement, and we want to use that as a strength, right? And so often those families are their primary teachers, and again, they influence those daily routines, and within those daily routines, we can emphasize learning and language and development based on that. So, next slide. So, just to break it down a little bit, within the birth to 12 months, we are expecting that the child's going to be, have a strong physical closeness, start to communicate with routines, and be responsive to the multiple caregivers. Often, again, they're cared for by multiple extended family members. So when you do, talk with these families, kind of asking who participates or who is involved, so that we can make sure that everyone gets, as much as we can, get educated on expectations, or making sure that they inform other family members in what should be the expectations. So next slide. And this is a big one. So 1 to 3 years is when a lot of our language and our emotional development, develops. And again, in this population, a lot of it is the bilingual language is pretty typical. Maybe older siblings speak English, but parents still speak Spanish in the home. I see that quite often. And then there's often with that strong emotional expression. And when we think about that, that's actually typically due to language expression rather than a self-regulation deficit. So these kids will often switch between languages, and sometimes that can be hard for everyone to understand them, and so how they express themselves. It should be noted that bilingualism does not cause a language delay, and so I think that is something that that I hear from families, that somebody has said that to them at some point, that oh, well, they're bilingual, so they shouldn't be talking until they're age 2. It's no, that's actually not normal in any context. And so there's a lot of that misinformation that sometimes we just need to kind of again ask families where they're at, and when we're assessing their language, we definitely want to be looking at both languages. So I know within the DAC clinic we have our speech language pathologists do have bilingual assessments that they do, one specifically Spanish and English, if there is Spanish in the home, or other languages, so that way we know kind of the true language ability of the child, not just in one language or the other. And so I think that's super important to be thinking about too. And then that's, I think, it for this slide. Next slide. And then when we're thinking about kind of a little bit older than 3 to 5, kind of we're still in that young ages, we're starting to talk about school readiness, and then what does it look like within the community or culture. And this is where Lisa kind of talked about the Legos with play, and observing other people around us. Are we being respectful? Our peer relationships are getting bigger, especially if we start to go to school or Head Start. But keeping in mind, what is the cultural aspect? So within the community, they may, eye contact may not be as acceptable, or they may be quieter or less assertive due to cultural norms around respect. And so thinking about that, as opposed to is that the temperament of the child, or is that a cultural thing, or is this really a concern? And so I think, always just asking families, what is your expectations? If you don't know, is always a good place to start. So next slide. And that goes into my typical variation versus developmental concerns. Consider the culture, evaluate the skills across settings. So if they are in school or they are in daycare, what does that look like there versus at home? And then is it actually causing any functional or daily challenges that are really more difficult for the family. And so really it's talking with the families on what their concerns are, but also like Lisa said, sometimes we do need to educate families and say, yeah, somebody may have said that bilingualism causes language delay, but actually we wouldn't expect this to be the delay that your child is seeing, and we would expect them to have this much language or this much abilities in these different areas. And so so looking at, does it affect their day-to-day functioning? So next slide. And so it's important, as we talked about, to do the developmental surveillance and screening using validated tools, and in the home language if possible. And then we should always share them with families, and kind of just see, did you understand the question correctly? Is this what you're trying to say? Is this what you're seeing in your child? To know, is this really a developmental problem, or is this just maybe a language barrier or a cultural difference that you're seeing? So next slide. And so the big thing that I think is important for these families is honoring their family values and priorities. So what kinds of things do they want to emphasize? I've found that over time, the more you meet with them and you have these touch points, that trust increases, and then they do come back more. But it's once we have to get them in there first, which is kind of what we talked about earlier. But also using clear communication. So if you are using an interpreter, making sure that you're avoiding any jargon, and that you ask families for understanding about what the conversation was about, which is really important. And then again, the family values of what does success look like? What do you want your child to be doing? And is this, kind of where they're at, or is this something that's, maybe an unrealistic goal, or should we actually be seeing them do a little bit more? And then next slide. And then monitoring progress, always is family-based, or I always think about a strength-based approach. So what kinds of things are they excelling in, and are they making improvements? And it may not be in every area, but asking families where are they at, and kind of emphasizing that, and then coming back and saying, hey, okay, let's talk about where we're still maybe struggling more, and then revisiting those goals, and then making them with the families. Next slide. So I think kind of overall, as we talk about behavior and development, it can be shaped by the culture. Family is a very important part of it, at least, in many cultures, but especially in this population. And then bilingualism is a strength. There's actually a lot of data that supports, stronger cognitive development with bilingual children, higher academic achievements, if we can get them engaged and make sure that we are continuing to get them the right supports that they need. But that's not always the case, so that's kind of the hard part. But it can be a huge advantage, and so I think taking that, thinking about that with families, and even kind of commenting on that of this is a positive for your child. And then addressing any barriers, as Jason talked about in the beginning. Transportation or work schedules were big ones, right? And then language access, and then trust, like Lisa said. Is there somebody who can talk with me in my language? Is there somebody that looks like me? Those can be very helpful in terms of getting people to kind of be more open and willing to keep coming back and having those touch points, and really to be able to monitor that development over time. So, and then, making sure that you are collaborating with the community partners. And then I just put in some resources, and it's, the things that Janelle has talked about, which is the learn the signs, act early, but also 0 to 3 has some really good videos, a lot of them Spanish for family or for providers to do trainings. But on the next slide, you'll also see that there's a lot of videos for families too, like why do kids have tantrums, and what kinds of things are we expecting a 2-year-old to be able to do, and how do we what should we be expecting, and how can we maybe mitigate or change, work on these behaviors that are happening, or these developmental differences that we're seeing. So and then the parent center is the last one, which I'm sure everybody probably at this point knows about. Yeah, that's the end of my part. Any questions?
I think we're ready to move to general questions, Janelle.
Great. That was such great information, and I appreciate all your efforts in doing that. I am going to open it up to see if anybody has any questions for our presenters. And so if nobody does, I'm just going to just toot everything that you guys do. And I loved, Lisa, how you're talking about just normalizing that conversation about development. I think that becomes such a critical thing that all of us can take an effort in improving our communities and our outreach on that, and that we're not just targeting one family. That's our normal thing that we always talk about in development. So I loved that point that you made. All right. Well, if there are no questions, then we will move on to our case study portion.
And Janelle, is it okay if I hop off?
Yes, it is.
Okay, perfect. Awesome. All right. Well, thanks everybody.
Thank you. I thought I had my case presentation pulled up, but I don't. So let me quickly pull it up. All right, so I am talking about a little, this is a combination of a bunch of families that I have seen that I would love some help on. So Mateo, this is not his name, and this is not an actual picture, so it has been de-identified and AI generated. So don't think I'm sharing things that aren't, that I don't have permission to. Anyways, so this little Mateo is a 3.5-year-old little boy. They recently immigrated into the US, and the family primarily speaks Spanish in the home. We've all seen kids like this and have probably worked with families. So Mateo's parents had reported ongoing concerns about his development, particularly his speech and social engagement. He's only using a few single words, and he does not combine them, and he often relies on leading the adults by the hand to communicate his needs. Parents also described limited eye contact, minimal interest in playing with other children, and he has a lot of distress with changes in routines, and also sometimes gets kind of nervous or anxious when they turn on unexpected noises. So that would be, parents have really said, like when we turn on the vacuum, or when mom blows dries her hair in the morning. So he has a lot of those sensory sensitivities. They brought this up with their pediatrician or their medical provider, and parents reported that they first brought up developmental concerns around 2.5 years of age. And the family did complete some of those screening tools, but it was inconsistent with a certified interpreter. And so I love how Lisa mentioned that you guys have those great care coordinators that can ask and answer those questions to parents, because I think that is what this family ran into. They weren't really sure how to answer those questions or didn't know exactly what they were being asked. So the family was told to watch and wait, and they didn't really know what to do. They eventually were referred, they said like 6 months later, finally to early intervention services, where he did qualify for early intervention and received speech language therapy. So family did notice that there was some progress, but that speech therapy was also often conducted with English, an English provider with limited Spanish support. So parents reported that they were unsure or hesitant to ask questions or share concerns. Sometimes they would have a translator or an interpreter, but it wasn't always there. So they have then been referred to a specialty referral because they have wanted to get an autism diagnosis. So what they experienced there was that there were lots of long wait times and a complex intake process where many of the things, like the intake forms, the appointment reminders, and communication was all provided to them in English. So again, they were unsure of where the next steps are and who to reach out to. So family, from their perspective, really have this mixed emotions of pursuing an autism diagnosis. They are concerned about that stigma and labeling, especially within their own community and their family network. They don't really know what that means or what their community will support. So they have a desire for answers, but they really have this fear about the diagnosis. So I'd love to, and like I said, this is a family that I've experienced many times and have these same concerns. So I'd love to hear your guys' discussions around building engagement, that language access and communication, some cultural perspectives on autism, and how to support the family after the diagnosis. So the hub members all have the questions that we'll be discussing in our breakout groups, and then we can come back and go over it. So Tori, do you want to put us in breakout rooms? Okay, we were talking a lot. So obviously our group had some great discussions around it. How about we start with Jennifer? What was your one thing from your group? But you're on mute, and maybe it was Colin that actually
Yeah, I
took
was gonna
notes.
say I actually took the notes. As far as how my cultural beliefs or stigma influence how the family views autism, the family just may not be comfortable discussing the delays, or their culture may focus on the positive aspects of the child as opposed to the deficits.
Great. Okay. Stacy. I don't know who took
Yeah,
notes.
I took notes. So we had two questions. The first one, what are the best practices for using interpreters during developmental screening and autism evaluations? And one thing that really stood out was that making sure that if we're using interpreters, that they speak the language and not necessarily this like the Spanish language, but like the autism language, the medical language. So there's understanding on that end. Um, it is really helpful. And then the other question we had is how can providers check for understanding and avoid unintentionally placing the burden of communication on the family? And one was having trust, having a relationship, so that's there. Also asking about other forms of communication. So um, using text, sometimes that's really helpful because there's automatic translation that happens. And so that might kind of make that conversation go just a little smoother. And instead of keep checking on understanding, it's just there.
That's a great one. And I liked your idea also of knowing the medical lingo in our group. It was talked about like also the different dialects of Spanish, knowing what your language profile is. So Alina really shared some great resources on that one. And what group am I missing? Leo.
It's me. I think we got the portion of just building engagement and trust. And I think one of the really important parts is to just respect the family and what they're saying. A lot of the times, no, well, maybe not a lot of the times, but sometimes providers may just try and push a lot of these suggestions onto families, or maybe even the medical system itself may just impose these suggestions onto the family that might just not work for them because of a cultural difference, or even just because of a time difference or anything really. Just even getting to know the family first is a great way to build trust, because when you know the family first, you get to know maybe a bit more about their family structure and about their culture. And once you know more about the family that you're working with, definitely could just build trust and respect between the provider and family.
Yeah, and that's a great reminder. I mean, I think we all try to take the time to do that, but it's a good reminder to do that listening aspect of it. So I appreciate that. Um, our group talked about some of the how do we support a family after a diagnosis. And Crystal from Nevada shared an amazing resource that all of us went, oh my gosh, I've never even thought about that. But it is the parking place card for so that if a family is struggling to go into the grocery store or parking and they might be a runner, like just a simple thing like that can be super helpful. So I loved that resource. And I loved, I mean, a ton of great resources. All of us have probably experienced a family that is struggling or going through some of these scenarios or a situation like this. So some great information and resources. Be sure to reach out and check out our Canvas page. And you guys are all have such knowledge on this call. I love learning from you as well. So I love the breakouts and discussing that. We are at time, so I am going to close it out and thank everybody for coming, and just remind you that our next session is May 27th, and Colleen from the Utah Parent Center is going to be presenting on to us about some of their supports and navigating different systems. So be sure to join us for that one. Thank you all. Enjoy the rest of your